our show Health and Wellness, Myths versus Facts. I'm Gargi Rawat. The primary difference between health and wellness is that health is the goal and wellness is the active process of achieving it. You truly cannot have health without first achieving wellness. And 2 years into the pandemic, our lives have become more sedentary than before. Long working hours, sedentary lifestyles, poor food choices and lack of physical activity have all contributed to a variety of lifestyle disorders. People with pre-existing disorders like diabetes and heart disease have been affected the most in the pandemic, and medication adherence must become a priority as we deal with the continuing effects of the pandemic. For some people, medical adherence itself is a new term to discover. Well, we have an expert panel with us to help answer all your questions and tell you about its importance. Today, we're joined by Dr. Manan V, Mehta, consultant diabetologist, Prakriti Health Clinic, the Metabolics, Mumbai, and Dr. Mayur Jain, interventional cardiologist, Kushal Cardiac Care, Thane. Thank you so much, doctors, for joining us on the program and sparing your time. Dr. Mehta, first to you. Poor adherence to medication in both long and short-term conditions increases the risk of morbidity, mortality, and cost of care. So what are the challenges faced by patients in adhering to prescribed medications?
Thank you so much, ma'am. Definitely, adherence is one of the biggest problems which patients face. We've tried to classify it into three categories. One is the cost of the medication. The other is the number of pills and the timing of those pills. And the third is usually forgetfulness and carelessness. So for the first two, please do approach your physician and ask them if you can take a generic variant or a biosimilar so that the cost of the tablet comes down. Ask if you can have combination medication so that the pill burden becomes a little lesser. Please keep a reminder in your phone. We have phones for everything now. So let's keep a reminder for that so that we can take the pills on time. And finally, as far as the forgetfulness and carelessness is concerned, please remember, if you have a train, if you don't get onto it, the train will go where it has to go. You won't get the benefit out of it. So if you want to get better, you want to get the advantages of your prescription, then adherence is a must. Discuss with us so we can help you better.
All right, Dr. Jain, now smart approaches provide a solution. Could you please tell us how self-monitoring devices help improving medical adherence?
Yeah, thank you. So self-monitoring devices have been the new things in diabetes. The world is getting digital and smart, so we should adhere to these smart devices. They help the patients to monitor their blood glucose levels throughout the day, wherein the patients can understand which foodstuffs are causing their sugar levels to go up. At the same time, these monitoring devices also motivate the patients who are on long-term diabetes treatment that their medicines are working well. When they see their sugar levels are under control, they adhere better to their medicines and insulin levels. Not only that, it helps the doctors to adjust the doses and to optimize the medical therapy of the patients when they see their home monitoring chart. Also, it warns the patients about very high glucose levels and very low glucose levels so that they can reach to the doctor or the hospital on time before it is too late or they get any complications from the varying sugar levels. So it is very important to do these things, get yourself checked, get home monitoring and motivate yourself to take your tablets on time because you will see the effects on the self-monitoring levels.
All right, you just don't realize how important it is first to go and get the prescription for medication and then make sure you follow what the doctor has told you. Dr. Mehta, if we talk about, home as well, what is the proper method for measuring and monitoring blood sugar and blood pressure levels at home? Because again, many people have the devices, have the machines, but there are certain do's and don'ts that they need to follow.
Yes, ma'am. So Dr. Jain said very rightly that, if we keep the monitoring at home, then we have a better idea. I don't have to wait for the 3 months before the patient walks into my clinic to check them. SMDG is self-monitoring of blood glucose. In general, how often to do it depends on your type of diabetes. Are you type 2 diabetic, type 1 diabetic, pregnancy-related diabetes, whether you're on insulin or not, so I can judge the frequency. But in general, for our average patient, checking the fasting sugar once a week and checking your post-meal sugar 2.5 hours post any meal, whether it's breakfast, lunch or dinner, those readings are important. For blood pressure, please do keep in mind, check in the morning and evening because cortisol levels vary. So your pressure, your pressure variability will be recorded if you chart it well. Always start it with the time, with what you ate, and what you had a little prior to that monitoring. Another thing you do is when you do the charting, get that data to me. Make sure that you have that data with you along with your blood work so that we can guide you better in terms of tailoring your prescription. Giving a general prescription is one thing. Personalizing and tailoring it can only be done if you give me enough data of what you've done at home.
All right, Dr. Jain, so, staying with this monitoring at home, home blood pressure monitoring also plays an important role in hypertension management. But can home blood pressure monitoring be a substitute for visits to your doctor?
Definitely. Why not? Home BP monitoring and ambulatory BP monitoring have in fact become norms now, even for the doctors, for diagnosing blood pressure, for labeling a patient as a hypertension patient, as well as to monitor the effect of their tablets. So home BP monitoring, actually it's important for the patient to know how to take blood pressure. It is very important to be in a sitting position with your back rested, especially you can sit on a chair with your feet on the ground for 2 to 5 minutes before taking blood pressure. Also avoid taking coffee, tea or tobacco in an hour before taking the blood pressure readings. So this is the ideal way to take blood pressure. Home BP monitoring gives you an idea how your blood pressure is throughout the day, if you are taking multiple readings throughout the day, or as advised by a doctor. I usually advise my patients to take it at 8 a.m., 2 p.m. and 8 p.m. when I change the tablet, or I start the tablet newly. For a newly diagnosed patient, they should monitor the BP thrice, and so that when they go to the doctor, it is easier for them to adjust their doses of the tablets and optimize their medical therapy. So home BP monitoring and ambulatory BP monitoring can be a substitute to going to the clinics. You can avoid frequent visits to the hospitals and clinics, but at the same time, the change in the tablet or stopping the tablet should be the decision of the doctor and not your own decision.
All right, Dr. Mehta, now what is the importance of HbA1c test for people with diabetes, and how often should they get this done? And do these tests then help people with diabetes lower their medication dose on their own? And when should a person with diabetes then ask his doctor for a change in the dosage of medicine?
Right, ma'am. So HbA1c, the HB stands for hemoglobin, the A1c stands for glycation. So what HbA1c essentially is the amount of sugar your hemoglobin has been exposed to over the last 3 months. So HbA1c gives me an average idea of your sugar over the last 3 months. Now this is a wonderful festive season we are going through. Patients will come to me in January with very nice fasting, very nice PP. But when I check the 3-month average, I realize that the control has been suboptimal because of some indulgences which have happened. So yes, HbA1c can be directly correlated with the level of your sugar control. Essentially, it also gives me an idea how well I'll be able to prevent diabetic complications from happening, because rather than a one-day reading alone, a 3-month average helps me a lot. As to self-changing of the medication is concerned, as far as diabetes, thyroid, cardiology, or dyslipidemic drugs are concerned, I actively discourage patients from changing their own dose unless I specifically give instructions that you can make this tablet half if your sugars are this much, you can make this more if your sugars are this much. But without consulting us, my staff or my health assistants, I never advise my patients to fudge their doses on their own.
All right, so that's important to keep in mind that, even if you're monitoring, you need to just go to the doctor and only then reduce your dosage or change any dosage that is required. Dr. Jain, many people with hypertension stop the medication when they find that their blood pressure has normalized. So what are the consequences of this?
That is the last thing I want any of my patients to do. So it is my duty, whenever I diagnose the patient with hypertension, in the first meeting itself, I tell them about the consequences of uncontrolled blood pressure. If you stop your tablets suddenly, you have to understand that your BP is controlled only because you are taking the tablet. If you are not taking the tablet or stopping it, then the BP may go very high and you may face consequences like stroke, paralysis, intracranial bleed, you can have bleeding in the brain, heart failure, kidney failure, blindness or vision loss because of retinal hemorrhages. So the consequences are very, very bleak, and you are taking this or inviting this trouble at what cost? Just taking 1 or 2 tablets in a day? So it is not worth. Believe me, whenever it is required, your doctor will ask you to decrease the dose of the medicine or stop it. Never stop the tablet without the doctor's advice. Yes, in some cases wherein the BP is diagnosed when the patient is obese, highly overweight, and the doctor prescribes medicine as well as lifestyle modification like daily exercise, walking, weight loss, diet, and if the patient loses significant amount of weight, his requirement of the blood pressure tablets may go down and he will be happy, but the decision to decrease the dose or to stop the tablet remains with your consultant physician or your doctor, because he is the best judge and he knows what are the consequences of stopping the tablet inadvertently when your blood pressure is not under control. So believe me guys, it's not good to stop a BP tablet unnecessarily without your doctor's advice, because the consequences, as I told you, are very severe and you don't want them in your life.
All right, so very important not to, change any medication on your own, and I think both you doctors have emphasized that. We'll slip into a short break now, doctors, and return with more questions for you. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about the importance of adhering to the medical protocols, the medicines that you're prescribed by your doctors, and not forgetting about it. Let's go across to our doctors now. Dr. Mehta, some people with diabetes and heart disease believe that if they forget to take their morning medicine, then they can just compensate by combining their morning and afternoon doses and take them at the same time. So tell us whether that is a good move or not.
See, that's a very tricky question, ma'am, because while we would like our patients to have the medications bang on the time when we ask them to, there is a reason for that. The reason is very simple, that all medications have their own pharmacokinetics. That is why we dose certain medications in the morning, certain medications in the evening. Also, we have relation with terms of food. So as much as possible, I would like my patients to adhere to the dosage as we have told, because taking it later might not have the result which is intended to A, and it might also have negative effects B. But you can always discuss with your doctor in terms of what medications can be taken. This is called missed dose protocol. So if I miss a dose, what do I do? Do I do a catch-up dose? For example, for thyroid, you can do a catch-up dose the next day where you can take the dose which you skipped yesterday and combine the two. As far as insulin is concerned, there is no catch-up dose. There can only be stat dosing. As far as cholesterol tablets are concerned, we like to give them after dinner so that there is better effect on hepatic neoglucogenesis. If the tablets contain metformin, for example, we like to give them after food. So there are multiple factors which go through. What I love to do is I sit with my patients, I talk to them, and I tell them that a good physician knows when not to give a tablet also. So you tell me your schedule, when do you think you'll be able to take this on time, and then I can tell them what their exact missed dose protocol can be. Remember, diabetes and sugar, all these lifestyle modifications are basically you've taken a loan from life. So you have to keep paying the EMI in terms of regular meditation, terms of regular medication, in terms of regular exercise, and in terms of regular diet.
All right, so important to keep all that in mind and basically try not to miss your morning dose of medication. Dr. Jain, if you can suggest some good or usual tips or ideas that will make it easier then for patients, to follow and keep up with medication adherence.
Yeah, there are few important tips here to follow. Especially, I would ask the patient's relatives and caregivers that they should have a tab on what medications the patient is on and what are the timings of the medications. In fact, patients can even maintain calendars or records of this. They can maintain a small book. I have seen so many of my beautiful old patients, they maintain a proper diary of what time with medication has to be taken, and I really appreciate them for that whenever they come to me. Also, there are very good boxes available in the medical shop wherein there are days labeled as well as timings labeled, and for those who are uneducated, parents are uneducated or they cannot read. So for such patients, the helpers or the caregivers can fill in the tablets in the similar boxes and the patient can take it easily. Also, in my practice, what I do, there are in India, luckily there are many combination drugs available. So it is of the prerogative of the doctors that they should keep the pill dose to the or the pill number to the minimum. So I like to use combination drugs in my therapy so that the number of pills the patient has to take in a day goes down, and this improves patient compliance tremendously and also gives us very good control of sugar and blood pressure. So the basic tips are: use combination drugs, keep a chart, try to maintain a diary, or use some medicine boxes available in the market which are very easy to follow for your old age parents or uh, people who cannot read. So for them, these boxes are very easy to take. That the green box is for the morning, the red is for the afternoon, the yellow is for the evening. And as rightly said by Dr. Mehta, cholesterol tablets has to be taken in the night because the enzymes which generate cholesterol are most active in the night. So therefore, the dosing should be very proper also, morning, afternoon, and evening. And these are the few tips wherein the patients cannot are very unlikely to miss the doses if they maintain all these things.
Right. Dr. Mehta, now hypoglycemic episodes can occur in people with diabetes. To overcome this and avoid a hyperglycemic condition, how much sugar or carbohydrates should they consume?
Yes, ma'am. Now, this is one of the biggest fear that all our patients have, and not just patients, even the physicians, even my residents, even my staff are always afraid that, sir, what do we do if the patient's sugar drops? First of all, if the sugar drops, the patient might have symptoms like sweaty palms, they feel faint, they feel thirsty, they feel hungry, and they will describe it in various terms. What you need to do is you need to check your sugar at that time. If it is between 54 and 70, it's called 11-1, where you can take sugar, but at the same time, you can even take a fruit because it's not that low. If it's below 54, you need to take sugar directly. Remember, not chocolates, because they are complex. It takes time for the stomach to break it down. Direct sugar or a direct candy is what works best. Third, if the patient is disoriented, if the patient is feeling faint, unable to remember, patient seems like they might fall, that's called level 3. So for them, to admit them and give them a dextrose in IV or to give them a glucagon injection, these are the options available. But practically in day-to-day life, what I tell all my patients is keep 3 things always with you: your glucometer, an apple, and a bottle of water. Because if you feel you are hypoglycemic, it could be that you are just dehydrated. Check your sugar and ensure that it's actually dropping below 90 for you to be that way. Another thing is, the best way to avoid hypoglycemia is to take your doses on time, have your monitoring in place. Basically, in a nutshell, a summary of the entire discussion very kindly, which we have been given the opportunity to discuss today, that will reduce your hypoglycemic episodes. Remember, as dangerous as hyperglycemia is, so is hypoglycemia. When the difference between your trough and peak, basically the difference between the lowest sugar of the day and the highest sugar of the day is too high, it's called glycemic variability. So as much as we want your sugar to be under control, we also want it to have a narrow range of variability. So keep a fruit with you, keep sugar with you if you're on insulin and your sugar has dropped below 70 on certain occasions. Keep a bottle of water with you and keep a glucometer with you. So these small things, I think, on the go for an average Indian working patient seem to be the practical tips. But ensure you immediately go to your doctor or any physician or any nurse and say that this is what has happened. Can I correct my doses? Not stop my doses, correct my doses.
All right. Dr. Jain, now why is it necessary to know blood cholesterol and lipid levels and how they impact our health? Some heart patients adopt a healthy lifestyle and as a result their cholesterol level goes down, but then they still have high good cholesterol levels. So what does that mean?
It has been years and decades now, we know already that high cholesterol or the high level of bad cholesterol causes blockages in the coronary arteries, and not only in the coronary arteries, in the arteries of your legs, in the arteries of your kidneys, in the arteries of the supplying the brain. So high cholesterol is not only bad for heart but also for the brain. So LDL cholesterol is the bad cholesterol HDL cholesterol is the good cholesterol, as everyone must be knowing now. So the guidelines for LDL, reduction of LDL have become very critical now. For any patients or for a routine patient, the LDL level should be less than 130. But if the patient is known diabetic or a hypertensive, or if there is family history of heart attack, then I usually target in my practice LDL levels of less than 100. So if the patient is on tablets and the LDL level has gone down, but the HDL level remains high, I am happy. HDL is a good cholesterol. So if the HDL levels are good and the LDL levels are going down, that means the medicine is working well and the risk of heart attack is decreasing. At the same time, there are a few tablets also which can increase the HDL levels. So you can consult your doctor for the same. But it is very important to remember that if you have a history of angioplasty done or a bypass done, or you have very uncontrolled diabetes, your LDL target should be as low as possible. Guidelines say LDL less than 55 for those with cardiovascular risk of more than 10%. There is a score called ASCVD score. If it is more than 10%, the LDL should go below 55. And therefore, in my clinical practice, my targets of LDL are much lower for my patients, because in the end, prevention is better than cure. So if you are keeping your cholesterol levels in a good limit, you can prevent coronary strokes from happening, cerebral strokes from happening. So you can prevent many complications if you just keep your cholesterol on the level. In the second breath, I would like to say that apart from medicines, good exercise, 30 minutes of walk daily, and good amount of any kind of aerobic exercise like swimming or cycling is a must to keep your cholesterols and sugars and blood pressure under control.
All right, doctors, thank you so much, for explaining this to us and talking about the importance of medical adherence. Thanks for your time, and thank you all for watching at home. Goodbye.